Hello guys, welcome back to Medico Days. Hope you're all doing good. So today in this video we'll be discussing about the Neetpg Pathology 2023 PYQs and also some of the other years pathology PYQs as well. But before moving on to the details of this video, I request you all to put your feedback about the toxicity in medical colleges. Do first year JRs have to be working like slaves or have to be treated badly by the senior PGs, that is the second years and third years? What is your opinion? Whether first years should suffer and work and continue there, or should first years stand up together for themselves? So quickly moving on to the details of this video, which of the following is true regarding Mendelian mode of inheritance? So answer is 2/3 of the Mendelian disorders are autosomal dominant. So autosomal dominant disorders account for 65% of Mendelian disorders, approximately 2/3, and autosomal recessive disorders make up 25%, and X-linked disorders account for 5% each. Next question. An elderly male who is a non-smoker presented with chronic cough, weight loss, fatigue, and hypercalcemia. Lung biopsy showed large atypical cells with hyperchromasia. What is the probable diagnosis? So here you can see that there is keratin pearls which are seen in the image, and there is also intercellular bridges, but that to be appreciated from the histology in this image it's quite difficult, but keratin pearls is very clearly seen, and so it is a feature of squamous cell carcinoma. It is strongly associated with smoking and it presents centrally. Next question. A young patient with retroperitoneal hemorrhage and hemarthrosis but no mucosal bleeding. Which clotting factors are deficient? So here this probably points towards a case of hemophilia, and in hemophilia there is hemophilia A and B. So in A there will be factor A deficiency, and B there will be factor 9 deficiency, and this causes deep tissue bleeding. Prolonged PT is seen, prolonged APTT is seen with normal PT. And moving on to the next question. An elderly male with marked lymphocytosis and leukocytosis and smudge cells on peripheral smear. Again, the features you need to be knowing about the features of CLL, CML, AML, ALL, all of these, and certain other CD counts in different conditions. All these, please go through them. So this smudge cells is a specific feature again of CLL, and the next step to be done in case of CLL is flow cytometry. Next question. A 25-year-old male with gum bleeding, thrombocytopenia and ore rods on peripheral smear. What is the likely diagnosis? So in this image you can see ore rods, and ore rods are seen in AML with T1517 and PML RARA fusion. Next question. A cement factory worker. Also the different types of AML, M1, M2, M3, all these please go through them because questions keep coming up from them. And next question. A cement factory worker with mesothelioma. This association is due to, so mesothelioma is associated with asbestosis, and asbestosis exposure also causes lung carcinoma, and asbestosis fibers induce the pleural plaques and interstitial fibrosis. So here you can see the image of asbestosis. Next question. So I've provided details about different diseases like byssinosis, bagasosis. Bagasosis is because of the sugarcane exposure, and byssinosis is because of cotton fibers. So all of these pneumoconiosis I've mentioned here. Please go through them. Next, a child with jaundice, splenomegaly and spherocytes on smear. Best diagnostic test is, so answer is osmotic fragility test, because hereditary spherocytosis shows spherocytes and increased osmotic fragility because of the cytoskeletal defects of ankyrin and spectrin. Next question. An African child with a jaw mass and T814 mutation. What is the diagnosis? So T814 is seen in Burkitt's lymphoma. It disrupts the c-MYC oncogene and it causes Burkitt's lymphoma, a B-cell non-Hodgkin's lymphoma and there will be starry sky appearance seen. Next question. A child presented to hospital with cola-colored urine, hypertension and puffiness of eyes. Lab investigations were done and creatinine was 2.5 mg per deciliter. Treatment was started, and despite treatment, the patient did not improve for the next 3 weeks. The creatinine value increased to 4.5 mg per deciliter. Which among the following electron microscopic findings will be seen in this patient? Answer is, there will be subepithelial deposits. Post-streptococcal glomerulonephritis shows subepithelial immune deposits, hums on the electron microscopy. Next question, a patient was transfused 4 units of blood 2 hours ago and now she complains of chest discomfort. X-ray shows bilateral fissural thickening. What is the most probable cause? So here the answer is fluid overload. You need to be knowing about the conditions like transfusion associated circulatory overload, and there are certain other conditions which are related to this blood transfusion, and please learn about them, because questions keep repeatedly coming from this blood transfusion area. Please go through them. Moving on to the next question, a 48-year-old man presented with complaints of facial puffiness, frothy urine and hypertension. He gives a history of infection with hepatitis B, and urine examination shows microscopic hematuria. Histopath of the kidney shows spike and dome pattern. So again, different types of nephropathy and their histopath image, very important questions keep repeatedly coming. Even for INICET, this area is very favorite, because every INICET exam they usually come up with one question from this nephropathy histopath image or related question. So here the diagnosis is membranous nephropathy, and the spike and dome pattern is diagnostic of this one. It is associated with anti-PLA2R antibodies. Again, the related antibodies, all these are very important. And in FSGS also there will be podocyte effacement, but there is no spikes. Again, the histology image of FSGS and all other nephropathies, please go through them, very important. Next question, a child with fever, fatigue and LVD on biopsy image is given. What is the diagnosis? So then this is a case of lymphocytic myocarditis. Here you can see the lymphocytes, a large number of lymphocytes in itself. So if you put a little guess, you can go get this answer. And please go through these type of questions as well. Don't miss out, because most of the people might be guessing out on questions like this also. So don't make a mistake on such questions. So make little intelligent guesses as well in Neetpg if you don't know the answer. And next question, Neetpg Pathology 2022 PYQs. Question number 1, choose a correct statement regarding the telomerase theory of aging. Again, a simple question, but recently this has become a favorite in INICET and in Neetpg as well. So please read about it. INICET especially, this area is a little favorite nowadays, because most of the INICET which has happened recently, they are asking questions regarding this telomerase. So here the answer is decreased telomere lengthening is associated with aging, and that is the correct statement. So telomeres, they shorten with each cell division, and it leads to the replicative senescence, that is cell cycle arrest or apoptosis, and aging correlates with progressive telomere attrition. So increased telomerase length means that there will be delay in aging, delays the aging. So if the telomerase length is less, it means that there is aging going on. Next question, a child presents with recurrent chest infections and abdominal pain. There is a history of 1 blood transfusion in the past. On examination, he had icterus and mild splenomegaly. Electrophoresis showed increased HbA2, HbF and S spike. What is the likely diagnosis? Again, a very important feature, S spike itself, most of the people will be guessing this answer even if they don't have much of an idea about this question. So S spike is seen in sickle cell disease. This is a very basic question, and please don't make mistakes in such questions, guys. And this video which I am making is just for a rapid recap, which you can use on the previous day of the exam, or when you do recap of your PYQs, so that it will enable you to just have a quick go through of all the questions in a very limited time, and you won't be missing out so much, because if you will be sitting with your questions, you might be sometimes you might be missing out. You will be reading the explanations a lot. I've kept all the explanations and the questions very briefly so that you can go through it fast, and the PDF is also available. You can just take it at a very nominal price from me, so that you can have a quick flip through the pages, and it'll be easier than the watching the video itself. But everything provided here is a concise one, so that you can use it on the previous day also. On the previous day, you can just go through all of the questions. Like if you have the PDF, then it's very easy. You can just flip through all the pages, so that you won't make any of the PYQs which come in the exam. Because if you make a PYQ wrong, that determines your rank, because your rank will very much, it'll go down, because everyone will go through PYQs. You can't miss out on PYQs. At least PYTs are also very important. That is rank determining. But PYQs, if you make it wrong, then your rank just goes down like really bad. Next question, why do neoplastic cells utilize Warburg metabolism? So answer is it forms the metabolic intermediates for growth. So Warburg effect, it prioritizes the glycolysis over oxidative phosphorylation, and thereby generates biosynthetic precursors like nucleotides and lipids for rapid proliferation. And Next one, an elderly patient presents with anemia and hemoglobinuria, and the investigations reveal increased LDH. The peripheral smear image is also given, which physical examination findings can support the diagnosis. So here, this is a case of microangiopathic hemolytic anemia, and here you can see schistocytes. And one important feature here is the mechanical second heart sound, which is usually seen here. And this MAHA, which is a microangiopathic hemolytic anemia, is often caused by mechanical heart valves, causing shearing stress. Next question, all are true about neutrophil extracellular traps, NETs, that is NETs, except, so answer is it contains mitochondrial DNA, which is a wrong statement, because NETs are composed of nuclear chromatin, that is DNA histone complexes and antimicrobial enzymes. And mitochondrial DNA is not at all involved in NETs. Next one, cystoscopy shows yellow-white bladder plaques with Michaelis-Guttman bodies. Again, Michaelis-Guttman bodies nowadays, recently questions are coming up. Like even in 2024, Michaelis-Guttman body question had come up. So recently, a becoming favorite area is this one. So here, the answer is malakoplakia. It should be like that. All these bodies which are seen in different cases, they are like a bouncer question. They are like these bodies are seen in which condition. You should be knowing all that, because there are lots of bodies like Ashoff bodies, then Schaumann bodies, all these, all the bodies and all the specific findings of certain diseases, you need to be like having them on the tip of your tongue, because questions are like coming up on such areas nowadays. And another feature of interstitial cystitis is that they will be usually having Hunner's ulcers. Next one, which measure increases the lifespan? So answer is 30% calorie reduction. So calorie restriction reduces oxidative damage by lowering the mitochondrial RS production and enhances the antioxidant defenses. Next question, a 56-year-old man was diagnosed with COVID-19 and was put on mechanical ventilation. He passed away after a week. So what is the most likely postmortem change seen in the lungs? So answer is fibrin-lined alveoli. So here it was a case of ARDS and in a COVID-19 patient. So it causes hyaline membranes lining the alveoli. And so that the feature which will be seen as the fibrin-lined alveoli, that is the correct statement here. Next question, a female presents with and also what are the changes seen in different days after an MI attack is also very important. Please go through them with different with this much time. What will be the change? What will be the gross appearance? What will be the microscope? All these changes, please go through them. Very important area again. Next, a female presented with fatigue routine. CBC analysis showed hemoglobin of 9, MCV of 60, RBC of 5.2 million. A peripheral smear showed microcytic hypochromic anemia. What is the next step investigation for this patient? So answer is HbA2 level, because here you can see, if you look at the image itself, there is something called the target sign which is seen, which is like a very important feature of thalassemia. And if you're not having an awareness about that, you can look at the other values, like this is all the values are low, so this is a microcytic anemia. Also there is high RBC count, and if you know about the Menza's index, please calculate that. Menza's index, again, it can come up in future as a question, because it is very basic one, like you should be knowing about the Menza's index. It is calculated by MCV, by the RBC count, and if it is less than 13, it points towards thalassemia, and if it is more than 13, it is iron deficiency anemia. So this is one index which we use to differentiate between thalassemia and iron deficiency anemia. So since the Menzer index is also less, so it mostly points towards a thalassemia itself, and in this patient we'll be going for HbA2 levels. Question number 10, a 56-year-old man presented with dragging pain in the abdomen. On examination, there is massive splenomegaly. Peripheral smear shows leukocytosis with increased myelocytes, metamyelocytes, and basophils. Which translocation is seen? Again, a lot of cells are being mentioned here, like myelocytes, metamyelocytes, and basophils. So this is something called as the college party appearance, that is because there are multiple types of cells seen, and that is seen in CML. So CML will be having a mutation of T922, that is the Philadelphia chromosome, producing the BCR-ABL fusion. Now, Neetpg pathology 2021 PYQs. A 70-year-old patient presented with cough, fatigability, and weight loss. He was diagnosed with squamous cell carcinoma on bronchoscopy. The resected specimen had a hilar lymph node that was 1 centimeter in size, and it also showed a black pigment. And what is a black pigment likely to be? So this black pigment is usually seen in is the anthracotic pigment, which is caused by the carbon particles from the air pollution. So it is seen in a condition called anthracosis, because macrophage will be engulfing the carbon particles and they transport them to the lymph nodes and accumulate, causing blackish discoloration. I forgot to keep an image here, but please go through the pictures like anthracotic pigment. How will it be? Next question. A 34-year-old woman presented to OPD with complaints of migratory joint pain. On examination, a pansystolic murmur is heard. Echocardiography reveals mitral regurgitation. Biopsy is performed and histopath image is shown. Based on the clinical finding and histopath, what is the most likely lesion? So here you can see that this lesion, you need to be knowing it, guys. This histopath image is a very, very important one. This is ash of body. You can't miss out on an ash of body. It is like a very basic question. Again, it is seen in acute rheumatic fever, and the features of acute rheumatic fever, again the Jones criteria, all this, please go through them. Very, very important. Acute rheumatic fever is something you can't miss out because most of the students will be getting this correct. And this histopath image, again very important. Ash of bodies, the caterpillar cells, all this, please go through them. And that is the anicho cells, which are also known as the caterpillar cells because they have the caterpillar like nuclei. So please read about the acute rheumatic fever. And yes. Now next question. A 30-year-old man presents with a 1-year history of fatigue. On examination, he had massive splenomegaly. His blood tests reveal anemia and a total leukocyte count of 150,000. Peripheral smear showed neutrophils, basophils, eosinophils, and immature myeloid cells, including myeloblasts, myelocytes, metamyelocytes. Again, a lot of cells are seen. College party appearance. What is the condition here? It is a condition of CML because of BCR-ABL fusion gene. And what is the most sensitive investigation here? So investigation here is FISH or PCR. So this was a previous question where we had the similar thing, CML, BCR-ABL mutation. Again, here in this question, the college party appearance, the myelocytes, metamyelocytes, and basophils. A large number of cells are seen. That is CML. So here, the most sensitive investigation is FISH and PCR. Next question. A girl with short stature, web neck, shield chest, and ankle swelling likely has. Answer is Turner syndrome. So the features like web neck, shield chest, short stature, all this points towards the Turner syndrome. You need to be knowing about the features of certain conditions like Down syndrome, Patau, Edward. All these are frequent questions and people will be having an idea about them. And so don't miss out on the questions like that. Next, a patient with occasional exposure to benzene presents with recurrent infections, fatigue, weight loss, and evening fevers. Which type of cancer is most commonly associated with chronic benzene exposure? Answer is leukemia because benzene metabolites, they cause bone marrow toxicity and AML. And the patient will be presenting with fatigue, infections, and weight loss. Next question. In iron deficiency anemia, all are increased except, answer is transferrin saturation, because in iron deficiency anemia there will be decreased levels of iron, ferritin, and transferrin saturation, and there will be increased TIBC, RBC protoporphyrin, and soluble transferrin receptors. Next question. A poor prognostic marker in multiple myeloma is, so the poor prognostic factor is beta-2 microglobulin, which reflects the tumor burden and the renal dysfunction, predicting aggressive disease. Next question. A pap smear from a patient shows hyperchromatic nuclei, irregular nuclear borders, and a low maturation index involving the full thickness of the epithelium without invasion beyond the basement membrane. What is the most likely diagnosis? Answer is dysplasia. It shows cellular atypia without invasion. Next question. A 12-year-old girl is brought by her mother due to concerns about her short stature compared to her peers. On physical examination, she had a web neck, low hairline, and shield-shaped chest. Turner syndrome is suspected. Which of the following finding is most likely to be associated with this condition? Answer is bilateral small streak ovaries, which is seen in Turner syndrome. Next question. An 18-year-old male presents with 2-month history of gum bleeding and fever. Examination reveals pallor and systemic findings are otherwise unremarkable. Lab results show hemoglobin of 3, leukocyte count of 1500, and platelet count of 15,000. So peripheral smear shows macrocytes and reticulocyte count of 0.5%. Bone marrow biopsy reveals fatty infiltration, absent megakaryocytes, and no immature cells. What is the most likely diagnosis? So answer here is idiopathic acquired aplastic anemia. Key features are the pancytopenia plus hypocellular marrow with fat replacement. which is seen in idiopathic acquired aplastic anemia. Next question, a child presents with palpable blanching purpura, abdominal pain, arthritis, hematuria and proteinuria. What is the most likely diagnosis? Here the answer is Henoch-Schönlein purpura, because palpable purpura, abdominal pain and arthritis are the triad of Henoch-Schönlein purpura, and there will be renal involvement, which will be showing hematuria or proteinuria due to IgA mediated glomerulonephritis. Next question, a 54-year-old patient presents with fatigue, tiredness and cervical lymphadenopathy. Total and DL differential leukocyte counts are normal and no immature cells are seen. A lymph node biopsy reveals diffuse effacement of the nodal architecture, atypical cells with indented nuclei and prominent nucleoli. Immunohistochemistry shows positivity for CD10 and BCL2. Most likely diagnosis is, so here it shows a follicular lymphoma and the features are CD10 and BCL2 positivity, and centrocytes of centroblasts are seen in the nodular pattern. Next question, a 32-year-old software engineer presents to outpatient department with complaints of EC fatigability. He reports sitting in front of a computer for 12 to 14 hours daily and consuming high diet and junk food with minimal fruits and vegetables. Lab investigations reveal hemoglobin of 9 and MCV of 120. Most likely diagnosis is, answer is folic acid deficiency. And so you need to be also knowing how to differentiate between folic acid deficiency and vitamin B12 deficiency, because it's very important, because in whenever in case of when you give folic acid supplementation in case of vitamin B12 deficiency, then the remaining stores of B12 are as well used up and the patient will be presenting with like aggravating features, like it'll be the anemia will go on increasing. So please you need to have an idea about how to differentiate between the folic acid deficiency and vitamin B12 deficiency. And next question, a chronic alcoholic presents with increased abdominal girth. Examination reveals shifting dullness and a liver span of less than 7 centimeters. Histopath shows intracytoplasmic eosinophilic inclusion in hepatocytes. What is the content of these inclusions? So again, the content of these inclusions are the intermediate filaments, because here it is mentioning about the Mallory bodies. Again, all these bodies and related conditions, you need to be knowing them. Named bodies are very, very important. They keep coming up in exam, and also their image. Please learn about that. It keeps coming up in exam nowadays. These are like favorite questions. Next, a 65-year-old female is diagnosed with pure red cell aplasia and a mediastinal mass. Which of the following can be the likely cause? So here the answer is thymoma, because it is the most common cause of paraneoplastic pure red cell aplasia. And since the question has pure red cell aplasia, the most likely answer here is thymoma. So that's it guys for this video. I'll come back with my new video with the remaining set of questions. Till then, stay tuned. Bye bye.